Hello. I see you are here for a color vision test. Very good. Well, I'm the doctor who will be examining you today, so welcome. So why do you think you are experiencing color blindness? Okay. So is it the brightness of colors that might be a little bit strange to you? Okay, so just not like normal? Okay, well, let me ask you just a few questions. And can you just confirm how to spell your first and last name, please? Great. And then do you wear glasses or contacts, or have you ever worn them? Okay. And when was the date of your last vision exam? And does any color blindness run in your family or any major eye issues, such as glaucoma? Okay. And what is your relation to them? Have you had any trauma to your eyes recently? Any accidents? Anything in a sports activity? What about any headaches? And you also said no recent eye issues when you visited the eye doctor, and you've never worn glasses before. Okay. So along with not seeing the brightness of colors currently, are you seeing any blurry vision? Are you having trouble reading? Okay. And what about when you use the computer? And what I'm going to do is a quick eye exam, and then I'll be checking for color blindness using a specific test. So I know you said you're currently having difficulty seeing the brightness in colors, and typically a person with those issues would specifically not be able to see red, green, blue, or a combination of both. So this test that I was speaking about will help me kind of determine what your issues are, if you have any. Okay? So let me start off with those few tests that I mentioned, and it's nothing you need to worry about, just your normal eye tests. So let me get my things ready here. And my booklet. Okay, so the first thing I'm going to have you do is just follow my finger. So just follow exactly where I move it, and I'm just going to look at your eyes, okay? Okay. Very good. Very good. Good job. Keep following. Good job. Okay, good. Now I would like to, let's see, I'm going to have you look straight at my nose and tell me how many fingers I'm holding up, okay? So remember, look straight at my nose. So here we go. Good. Okay, let me just do one more. Okay, good. Next, I'm going to have you read some lines for me. So the first thing I'll have you do is cover your left eye. So the lowest line that you can for me. Okay, and can you read the one below that? It's a little difficult. Okay, can you cover your other eye for me? And same thing, the lowest line that you can. Okay, can you do the one lower? You can't. Okay. Okay, so you definitely can't read this one at all? Yeah, it's difficult. Okay. Have you ever struggled with that test in the past? No. And how blurry would you say that last line was? I'm going to get my flashlight and just take a look at your pupil response. So just look straight ahead for me, and I'm going to flash this light into your eyes, but it shouldn't be bothersome. So straight ahead. Very good. You can blink. Okay, good. And I'm just going to lift up your eyelid. So let me just do that. Now just look up for me. And down. Left. And right. Okay, same thing on the other side. Hold it up, then look up, look down, look left, and look right. Okay. Now on to the color blindness test. So I'll be using what most eye doctors use, this color blindness booklet. Okay. And this is a very popular assessment which will allow me to, like I said, determine if you do have any issues or perhaps if you maybe just need some glasses. Okay. And after I'm done with this, the last thing I'll do is just dilate your eyes to look at them one more time, and then you will be all set. So let's start with this. Are you still relaxed? Good, you don't need anything. Okay, and there's nothing to worry about with this one too, so let's see what I'm going to start with. Okay, so your job is to just tell me what number you see on a piece of paper, okay? So, here is our first one. Okay, so can you tell me what number you see? Going to be taking some notes in between to record your answers. Okay, now to the next one. Okay, next one? What number do you see? Okay. Okay, so let me know for this one what number you see, or if you don't see anything at all. Okay, there you go. Okay. Okay, and the next one. What number do you see? Good. And just a few more. Okay, this one. Can you tell me the number? Okay. Good. And now what about this one? Let me know if you see a number or if you see nothing at all. Okay. Good. You're doing a great job. And let me see what I want to do next. Do this one next. And then just one more after this. So, what do you see here? Okay. And now just one more. Here you go. So what about this one? Okay. Very good. So there are a few more that I could show you, but you actually did a fantastic job. So you got everything correct. And based off of that, I do not believe you have any color blindness issues right now. But what I do think is you might need a slight prescription. So I'm going to dilate your eyes and just take one more look at them just to ensure there's no other issues going on. And then we will go from there. So this will just take a few moments after I put the drops in your eyes to actually dilate. And of course your eyes will be sensitive to light when you leave here today, so you'll want to make sure you wear sunglasses. And also, if you're going back to work on a computer after this appointment, it will definitely be blurry, so you might have to wait a few hours. Let me just get the drops. Just gonna need you to tilt your head back. I'll start with this eye first. Okay. Okay, very good. And now the other eye. Okay, tilt your head back again. And there you go. Okay, now just blink. Very good. Alright, so I'll be back in a few minutes and just do that final check of your eyes. Okay, so are your eyes blurry? Good. That means it worked. So let me just take one more look. Just look at me straight ahead. And very good. Just gonna make sure everything looks good. Okay. And just look up again. Look down. And side to side. Okay, good. Everything looks good there as well. So like I said, I think you do need a slight prescription. Don't worry, it's nothing too heavy, just enough for reading. So I think what you've been experiencing is just some slightly blurred vision, and I do not believe it has anything to do with colors. Since you've never worn glasses or contacts before, sometimes we can be a little bit confused once we start needing glasses, since obviously you're not used to blurred vision. So I think this will definitely help you in the future. So what I'm going to do is schedule you an appointment to come back and pick out some glasses with me. We have a large selection of glasses here, so you'll be able to find ones that you like, and we'll make sure that they are a good fit for your face. So I can get you scheduled in now if you'd like. Okay, so when would you like to come in? Next week? Following week? Next week? Yeah. I do recommend coming in soon, so that's perfect. Alright, so what about, looking at my schedule here, Tuesday at 2 o'clock? That works? So I look forward to seeing you next week, and we'll have some fun picking out glasses for you. So thanks for coming in. I really enjoyed getting to know you a little bit today, and I will see you next week. Have a good day.